About the immediate post-op passive range of motion exercises to do for a dog that just received an FHO. So initially what you can do is for the first 4 days, you're going to be doing a lot of icing. So I would put the ice on and do your flexion at the same time you're icing, because it'll just kind of help you get that part of the exercise out of the way. And it's always easy to flex the hip. Put your hand on their back, hand just below their knee. Flex their knee, because it's easier to flex the hip joint when you have the knee flexed. And so you're just going to want to hold it in that position, just in a flexed position with the ice pack on top, and then you can hold it there. And then you're going to ice it for 10 to 15 minutes. So during that period of time, you can also just get it back into a neutral position, and then go back up to the flex, and then back to neutral. And then what I would do about halfway through your timing of your icing is then start to do gentle extension. And what you're going to want to do, they're not going to like this immediately post-op, so get your hand just firmly on their knee and just gently take it back. You're not going to be able to go very far because these muscles are going to be pretty tight initially, but it will help to have the ice on there because it's helping with pain control. So eventually what you're going to want to do is get full range of motion back. But what we'll do is after the first 4 days, then you'll be able to put some heat on it prior to doing the exercises, and then you will ice after the exercises. So I'm going to take this off so you can see everything. So flexing is done like this with your hand just below the knee. Flex the knee and then come forward all the way up. It's basically pushing your hands together. And then the extension is just get your hand firmly just a little bit above the knee and then just gently take it back. While you're supporting this back edge, just gently take it back. And go back as far as you can before they, show some discomfort. Try to hold it as long as you possibly can. And then as soon as they protest, then release it. And then you can come back and forth and just do some range of motion through it. And just gently. And then what I would do is every third to fifth exercise like this, then I would pause. As long as you possibly can until they start to get, agitated. And then you do the same with the flexion. And that's all you need to do.